Hello, everybody, and welcome to PKD and Nutrition. I am excited that you guys are all here. I'm going to go ahead and get started and introduce myself in a little bit as to be respectful of everybody's time. All right. So make sure you are in a comfy spot. You got some hydration, and let's get started. So today I'm going to be looking into PKD and nutrition and giving you an overview about what we know and new frontiers. Really exciting stuff. So before we get started, let me see if I can turn off that. There we go. Okay. So before we get started, if you have any questions, go ahead and submit them in the chat box. It will help me keep track of the questions, but also it will help me get to them at the end. So at the end today, I'm going to do a Q&A session, and it'll be about 15 minutes. I'm going to try to get to as many of your questions as possible. Also, I am not able to address any specific medical questions, so I'm not able to do that. And just so you know, I do have an office dog. Her name is Riley. So if the mailman comes, you're going to hear her. So a lot of the people I work with, I hear very similar things from them. And to be honest, these things kind of unsettle me, and I want to ask you some of these things. Have you ever been told there is nothing you can do with your PKD? Have you been told come back when your kidneys start to fail? Have you ever been told that your options really are dialysis or transplant? I hear this from my clients all the time. Have you ever felt that, you know, there's got to be something more that I can do? There has to be something more. Have you ever felt overwhelmed by all the nutrition advice online? I know I've gone into those rabbit holes myself and felt overwhelmed. And have you ever felt fear about your food choices or thinking maybe I'm hurting my kidneys? So all these things are really valid things, and they're the reason that I'm here today. So I want to go into some of this. So my goals today are, first, to answer the question, can nutrition help PKD? The $1 million question, right? The second question that I want to answer is, okay, where do I start? And then the third goal today is to show you all of your nutrition opportunities in one place, not all over the internet. So my agenda today is going to start with the what. I truly believe that if you are going to understand something, you need to know the what. That's your foundation. And then from the what, we can get into the why and the how. So understanding that really helps impact of results. So the what I'm going to go into today is a little bit about your kidneys and PKD, and then some common complications and risk factors. Now, I'm going to approach them from a different way, and I think you'll be surprised how we're going to look at those today. And then the why and how, that's when I'm going to get into the nutrition, what we do know, because we do know some stuff, and then all those new frontiers. That's really where all your options are. So just a little bit about myself. My name is Diana Bruen, and those letters after my name basically mean I have been a dietitian for a while. I'm a registered dietitian with a focus in the kidneys. Specifically, I'm an expert in PKD and PKD nutrition. If any of you are in the RenNu Facebook or even on Facebook, you'll know that I am one of the pioneers in plant-focused ketogenic therapy and developing that. Also, over my long career, I have collaborated with many research experts and the top nephrologist to really be on the cutting edge of what everything means and to have that really good science and education background. And I developed the RenNu PKD nutrition program with a group of dietitians and just finished running it. So that's just a little bit of my background. But what's really important is my belief. My belief is that nutrition for PKD can be proactive and preventative. Now tell me, how many times have you heard proactive and preventative in the same senses as PKD? And I get super excited about this. And where I come from is wanting to provide clarity, providing compassion, and also kidney nutrition know-how. I love all things science, but one of my superpowers is being able to take scientific information and translate it into understandable things, but not only that, but to take that to nutrition and then move it towards the table. So make it really doable. All right, so a little bit about the kidneys 411. This is the what. As you can see here, I've got a slice of the kidneys and we're looking at it. And I'm sure you guys are pretty familiar with this, but it never hurts to go through a review. So in your kidneys, you've got your nephron. This little piece here is your nephron. So your blood with the waste goes in, it gets filtered through your nephron, and then it goes into these tubules, and it's in these tubules that fluids reabsorbed or your nutrients are reabsorbed, and it's a very particular balance there. And then the stuff that's not reabsorbed is eliminated through your urine. And why is this important? Because looking at PKD, you want to know about this filter and you want to know how PKD impacts these tubules. So polycystic kidney disease. We all know that it's inherited with a small group of people that just have a gene mutation. I'm not going to go into all the background of that today. But what's interesting is the actual word polycystic means many fluid-filled sacs. And that's literally what it is. It's slow-growing cyst in the kidneys. So here is a very similar image to the last one. So you've got your kidney and then you've got your filtration, and you can see here is that tubule. It is in that tubule that those slow growing cysts grow. And then running through that tubule is the fluid, and then the cysts fill with the fluid and they pouch off and can even break off. So why is this important? Because a lot of dietary interventions and a lot of what we are learning about the science of PKD is right in here. This is where all the good stuff happens. This is where we can make changes. So over time, cysts do increase in size and number, and they cause damage. And that damage is primarily to the kidneys. And as the cysts grow and cause more damage, we know that there is a decrease in kidney function. So if you guys have seen this before, I think this is a really good visual. I'm a big fan of seeing it and understanding it. So what we have here is a normal kidney, and then showing as cysts grow how the size of the kidneys grow. Now, why am I showing you this? There's two things that I really want you to see. First, here, this red line, that is speaking to your kidney function. It's referred to as your GFR. So this red line is your kidney function. And the other thing I want you to see is that kidney function right around here starts to dip. This is just what is typically seen in PKD. And so you can see around 50 to 60 years old, we see that decline in kidney function. But you'll note the kidneys and the cyst are growing during this period, and we don't see kidney decline. All right, so now to get into the good stuff. What we know. What we know is Google isn't right, but Google actually isn't wrong. A lot of people that I work with, they go to the internet to try to find information. There's a lot out there, not always bad, not always good. But how do you know which is which? So I'm going to get into the complications of PKD, and this is more how it presents. And don't worry, I'm going to show you a great way to look at this and everything the complications tell us. So one of the first complications of PKD that's often seen first is hypertension. Usually around the 20s or 30s, someone will develop hypertension. And that's about 60% of the people with PKD. And if you're not one of those, that's fantastic. Another complication of PKD is slow growing cyst. Majority in the kidney, some do go to the liver and other places in the body. Another complication is fibrosis and inflammation. And what I mean by fibrosis is there's actually some laying down of scar around the cyst, and there's some inflammation that comes with that, and also with kidney damage. And so that's one of the complications. A lot of times that's very low level inflammation, not the kind that you would feel like you are getting the flu or anything like that. And then another complication is impaired kidney function. We do know that not only are the cysts growing and changing the structure of the kidney, but they are pressing on a lot of the blood vessels there too. And the last complication that is typically presents with PKD is protein in the urine. So generally, we shouldn't have protein in our urine. With a lot of PKD people, it spills over into the urine. And more protein in your urine is associated with larger kidney volume, which we don't want, and then also a faster decline in function. So I challenge you right now to look at these complications of PKD, and let's change our mindset, because I like to see them as opportunities with PKD. Every single one of these has a dietary intervention or a medical intervention to help combat these. So these are actually targeted areas that are opportunities with PKD, telling us all of these are associated with faster progressing disease. So they're areas that we can target interventions. So I also want to point out some risk factors, and these are risk factors that have, through all the studies, been shown to be associated with faster progressing PKD. So looking at them, again, I'm going to challenge you to not think in risk factors, but to think in areas to target. So I took that list of risk factors, and put them into what is modifiable: blood pressure, protein in your urine, if you are carrying some extra weight. And then I added total kidney volume and put a question after that. And then I also added early GFR decline, that early kidney function decline. So these are all the modifiable areas we can target. And unfortunately, Not modifiable is being diagnosed young, what gene you have for the PKD mutation, and if you're male or female. That's stuff that I don't have a magic wand to change. I wish I did. So another area to look at that we can impact is PKD and specifically cyst growth. So we know that PKD leads to kidney cysts. And one of the reasons of the kidney cyst growing is our genes, the PKD1 and PKD2. Again, we can't change that. But this whole other area of kidney injury and stressors, that is where we want to focus. So do you ever wonder why the same family members or in the same family have, the same gene, inherited it, and other, cysts grow differently, and everybody has a different rate of PKD progression? There's a huge variability. That really comes down to these kidney injuries and stressors, and those are things that we can target. So right now, these are generally accepted treatment strategies, and there's no standardized treatment. However, it is coming in the next couple years. More on that to come in another talk. But these are the current treatment strategies, and a lot of you are probably familiar with them. Hypertension management, lifestyle modifications, and I'll go on a little bit about that in the next slide. Treat the complications, and this really is related to the kidney and managing kidney disease. And then current treatment strategies are dialysis and transplant. Blood pressure meds, those have been shown to be proactive, and you'll probably hear them referred to ACE or ARBs. The ACE are your lisinoprils, your pills, and the ARBs are, the most common one is losartan, the sartans. And then also you've got tolvaptan and JNRQ. Now, looking at all of these, this feels like supportive care to me. Like, this does not, and don't get me wrong, I support all of this. They all have huge benefits for different people, but it feels like supportive care. And I would love to, and I'm part of changing the conversation from PKD kidney disease to PKD kidney health and being more proactive. So just to go into a little bit more of lifestyle modifications. And so I just did a general summary here. These recommendations come directly from the PKD Foundation and the National Institute of Health. So I'm going to read through these and then go back and just point out a couple of things that really hit me. They recommend healthy diet and weight, protein, restrict with decreased kidney function, salt, avoid excess and limit substitutes, fluid, avoid dehydration, 2 to 3 quarts of urine a day. And you may need to limit potassium and phosphorus. So looking at these recommendations, there's nothing individualized to them. We all need to have a healthy diet and weight. So protein, what does it mean to restrict with a decreased function, and why only with a decreased function? They seem very generic to me, and I can see why a lot of the people that I work with are frustrated because they don't know a lot of the how to do this, or even what the recommendations are or why the recommendations are made. So 2 of these I do really actually like, and that's the salt and the fluid. So I'm going to highlight those a little bit. And if you are coming to this talk today, just starting your PKD health nutrition journey, this is where you want to start. This is step 1 and step 2. Going to make these steps that are absolutely doable will make a huge impact in your progression of disease. So looking at salt, and I use salt and sodium interchangeably. So salt and PKD. The why is a diet that is high in sodium, which is the very typical American diet, is associated with increased cyst growth. No thanks. That increased cyst growth is associated with a greater kidney volume. So the term that you all often here is your TKV, your total kidney volume. That's how big it is. And it's also associated with blood pressure increases, poorly managed blood pressure. That is one of the top 2 drivers to dialysis. And a high salt diet has a dramatic increase in risk for stones, which folks with PKD are at higher risk anyway. So this is the why. And there's a lot of other reasons, but these are the top ones. So the how is to set a daily goal. Now, this is a very generic daily goal, 1,500 to 2,000 milligrams. This is a good goal to aim for. I do like to individualize sodium goals with people, but this is a great place to start. So how do you start there? So where you start, first step, and this might seem simple, but you will get great outcomes with this. Step 1, check your pantry. Whatever you have in your house, in your pantry, that's what you're going to eat. What are you looking for? So you're looking for processed food or anything that comes in a box, bag, can, anything like that. And your second step is to look at the label. I love to teach people to look at labels, what to look for. It is much easier than you guys think. So just a little note there, low salt is 140 milligrams or less. And then the third step is reduce your processed food. And what you'll find is that those labels that have the highest sodium are the ones that are going to be the processed food. So even though I have a salt shaker here, I'm not even talking about a salt shaker on the table. The best place to attack your salt intake is with your processed food. Why? Because 70 to 85% of all the salt we get is in our processed food. So just doing these 3 steps or replacing something in your pantry with a lower sodium option will get you to where you need to be with your salt. I'm usually pretty amazed when I do a pantry clean out with somebody. We find stuff and, you know, there's always a good laugh about some of the stuff they've been using that they never looked at, that they're like, oh my goodness, I might as well just be eating straight salt. So there's always an aha moment there. So hydration and PKD. The why of this is good hydration has been associated with slower cyst growth. The why is because the mechanism of PKD, the formation of the cyst, there are certain pathways. And don't worry, I'm not about to break out in a science lesson here. But those pathways are triggered when you are not basically slightly overhydrated. So what we want to do is make sure that the pathways are not triggered in your body that drive cyst growth. And hydration is one way to do that. Can you see, guys? I'm trying to refrain from breaking out into some science terms. So good hydration, I say, mimics tolvaptan. So tolvaptan goes in and tries to turn off some of the receptors that are in the pathway that is increased with PKD. Good hydration does not signal those pathways. So it's very similar to mimicking tolvaptan. And also throw in the added bonus that good hydration also decreases your risk for stones. Now there's a lot more that good hydration does, but these are the top ones that I wanted to pick out to get you started. So how? If you think back to the recommendations, they were saying 2 to 3 quarts of urine. So yes, I've worked with people who measure their urine. Yes, it is a great option, but most of the people that I know don't start there. So where do you start? So aim for 3 to 4 liters a day. This is just a very general recommendation, but it really often depends on where you are right now. And so that is about 100 to 130 ounces. So 1 liter, you know, those big Nalgene's, 1 liter is 1 full Nalgene. So this is a good amount of hydration to not signal the pathways in your body that drive cyst growth. So where do you start with hydration? The first step is figure out how much are you actually drinking. Measure throughout the day, measure your favorite cup, add it up, start there. How much are you drinking? You might already be at your goal. And on that note, if you're not at your goal and start at, you might be at 1 liter, you might be at 2 liters. So wherever you are, set a fluid goal. And you don't want to jump from 1 liters to 3 liters because you're never going to get any sleep. You're going to be up all night. So make that fluid goal very doable. And what I recommend is the step 3. So add 8 ounces of fluid every day. Get your bladder used to it, get your body used to it. So whatever you are drinking, because you figured it out in step 1, add 8 ounces one day, and then the next day, the next couple days, do it again until you hit that fluid goal. And your fluid goal could be different week to week as you gradually build up. Okay. So that was just an overview of what we know. Now, to get into the new frontiers, and what I want to say is that diet absolutely is a disease modifier in PKD. There are opportunities to change how your disease progresses. You have that power. So I want to go through an overview now for you. So I love this slide because it shows you in the last, I'd say 3 to 5 years, there has been an explosion of groundbreaking research, understanding about the PKD genes, understanding about cyst, understanding about how they function. And all of this has not only led to more research and more funding towards research, but all of it, a lot of it pointed to diet. So some of the emerging research, and you guys, if you're in Dr. Wimes's group or RenNu, you're familiar with some of this, but hopefully some of you, this might be the first time you are seeing some of it. So it really is mind-blowing. So some of the emerging and active research, deals with crystal formation, and I'll get into this, and this is in your urine and your fluid. It also deals with, again, urine, the particles that are in it, and pH. It deals with ketones, the primary one being called BHB, and this deals with ketogenic therapy. Also, acid and base balance in your body. One area I love is that there's emerging research about PKD warrior beliefs, and that's you guys. The desire to be more proactive, the desire to understand more, and but also everything that comes with having PKD, from the emotional aspects to the physical aspects. And there's a lot of new work out on that that's showing the medical field that it's so important to view you guys as whole people, which I believe, and more than just kidneys. And then also cyst metabolism. And what this means is what cysts use to grow and multiply. So all of this has been bursting on to the scene in the last several years. Exciting. So I love this visual. And anybody who wants it, you can get in touch with me and I will send it to you. It is great to look at all your nutrition opportunities to support kidney health and PKD. So I am going to touch on a few of these, but just to go around, we touched on sodium and hydration. So also gut health. What happens in your gut affects the waste in your blood. It affects how your kidney function and absolutely impacts PKD. Also, protein, looking at what type of protein and how much, and both the gut health and your protein deal directly with your toxins. And if you think to your labs, the #1 measure of toxins is creatinine. Also, something called PROW. This goes back to the acid-base balance in your body. The more balanced, the better for your PKD. Some other nutrition opportunities is inflammation. being proactive and fighting, giving your body the tools to fight off that inflammation so it takes some of the stress. Micronutrients, there's definitely good things that those micronutrients help with inflammation. Hydration we went on. And then over here in this section, I've got ketogenic therapy and also intermittent fasting, which can be a part of ketogenic therapy, and then oxalate management. Now, looking at all of these, this is a lot, and I love it. But what's really important to know is that every single one of these on its own is beneficial. So you don't have to do all of them at one time. And it really, your nutrition opportunities to support your kidney health can be completely individualized to your lifestyle and what works for you with different priorities. Okay, so just to break it down into proactive and protective nutrition, there's three main areas. There's areas that have been shown to slow cyst growth. And of course, that is what we all want. Either stop it, slow it, or reduce the formation. Also, reduce kidney stressors is another area to take the stress off the kidneys. And then the last bucket is anti-inflammatory and kidney protective. You always have to consider the kidneys when you are making changes, because that is what it's all about, is your kidney health. So look at all of these: slowing cyst growth, hydration, sodium, ketogenic therapy, and that's ketones. And then BHB is short for a ketone. That's the abbreviation. And then also to slow cyst growth, and sometimes even potentially shrink it, there's reduce your kidney stressors. So here we've got the kidney stressors, and these are the ones that have been shown to directly impact PKD. It's your protein and your kidneys. It's your protein, both the type and the amount, those crystal formations in your urine, and the acid and base balance. And it's okay if all this is new to you. You are not expected to know all of this. This is just introducing you to it. So it is on your radar as an option. And then in anti-inflammatory and kidney protective, we've got ketones again. I don't know if you knew it, but ketones are actually anti-inflammatory. Omega-3 fatty acids, plant-focused eating, supplements. And then the last one, even though it is not nutrition, is mindset. Because absolutely your mindset is involved with all of this. So there's your three areas to do proactive and protective nutrition and all the options. So I want to go a little bit into an overview of some of those. And of course, I had to put in a picture of food because the dietitian in me had to. So looking at protein type and amount. So the amount really does matter when you have PKD and CKD. So the general recommendation is 0.6 to 0.8 grams of protein per kilogram of your weight. And I put that in there for people who like numbers. Now, again, this is a very generalized recommendation. Each protein recommendation should be adjusted for medications, for you individually, for what your function is. So there is some nuances there. Also, animal versus plant proteins, there is a difference. There's a huge difference in how they break down in your body, how they stress your kidneys, and how they impact your waist. And of course, the big goal is to cut back on all of that. So more plant focused, I'm going to give you a couple highlights of more plant focused. And notice I don't say vegetarian. Notice I don't say vegan, plant focused. So more plant focused is automatically much lower in protein. So just switching some of that animal meat to more plant focused, like I know you've heard Meatless Mondays, that same concept, you are automatically lowering your protein intake, automatically reducing the stress on your kidneys. Also, you're adding more fiber. That is a happy heart and a happy gut. So there is this belief that if you cut back on animal meat, that you're not going to meet your needs. Not true. Plant-focused diet and a plant sources of protein will 100% meet your protein needs. So just for example, the average American eats 1.2 grams of protein per kilogram of their weight. Do you see how much higher that is than this? That's the average American. Believe me, reducing the protein amount, you will meet your needs. And also you'll produce less acid because animal protein produces acids in your body, making your kidneys work harder. And added bonus, a lot of the plant-focused eating adds base. So why is this important? All connected with slower progression of PKD. So now to get a little bit into crystal formation and management. So the goal is to really reduce your load. So you're reducing those crystals that are running through your kidneys, because when they run through your kidneys, what they do, let me see if I can mute everybody here, get some background noise. When those crystals run through your kidneys, they can be drivers of the same pathways that increase fluid in the cyst and also cyst formation. So the goal is to reduce those crystal load so that we don't do it. And this is very proactive. And the main 3 areas to reduce crystal load is something called oxalates. You might have heard that. The other is something called phosphorus, and the third is uric acid. So these are the 3 areas that you can manage. And when I say manage, you reduce your intake. And then there's also some things you can do about how you are eating to make sure that these crystals don't get to your kidneys. Of these 3, the one that we can manage the best and will have the biggest impact is your oxalates. And you can see here's a picture of spinach. Spinach is definitely high in oxalates. So reducing your crystal load is managing your oxalates. There's some foods that you want to limit. There's some foods that you want to be aware of. And so you're reducing your intake of those. For phosphorus, it has 3 different levels, and I'm not going to go into that. But the main one you want to avoid is any added phosphorus. And you can see I found a nice little picture of a bunch of junk food. Everyone associates phosphorus with a cola, but there's other things too. Did you know that meat has phosphorus? Anything that has protein has phosphorus. So also adjusting your intake will also help lower that. And then uric acid, this is lowered by, this is primarily in our diets from animals. So crystal formation, reduce those crystals, reduces the kidney stressors. So I was talking to someone I was working with the other day, and he mentioned he was excited to go over his labs with me. And it just, it really just, hit me that more often there's so much fear around labs, and there's so much, well, when is my function going to decline, or what's the next lab going to tell me? And I've started having those conversations with people that now they've switched that mindset to they're excited to look at their labs and see how their diet has impacted their labs. And as much as I love labs, I love digging into them. They tell me lots of good stuff and areas that we can focus and target on. I do really like to educate people I work with on how to understand their labs. And that's really important, understanding everything that affects them. But another area to be proactive regarding your labs is your urine. And my question is urine the magic 8 ball with PKD? So I spent quite a few months working with Thomas Wimes and several other people with his lab to understand the balance of what's going on in the urine at PKD. And what I can tell you is it tells us a lot. It looks at those particles. Urine tells you what your pH is, and all of these things also can tell you how you're doing in your diet. It tells you, and this might be something you've heard of before, if you have citrate, if you have sodium, what your calcium levels are. It tells you how you're doing on your microcrystals, if there's another area that a little more work would be beneficial. It also tells you how well you're hydrated and how much protein is possibly spilling, if it is. And all these things can change with diet. And understanding your urine, if you get it done, or even if you start requesting to have your urine looked at, will be able to individually tell you some areas for improvement or some things you didn't know. And I view that as a great opportunity. Okay, ketogenic diet. So this is going to be just a very brief overview. So the research findings of the ketogenic diet have shown, and then these are preclinical, hence I got my mouse. The research findings show that a ketogenic diet inhibited cyst growth. In some areas, it actually caused the cyst to shrink. That there was a reduction in kidney size and cyst area. With that came an improved kidney function and a reduced fibrosis, which is that scarring in between dealing with inflammation. So the research findings, all of these, this is fantastic. This was really the first time that a modification was able to be shown to be done with diet. And I wasn't surprised it was diet. So if you're not familiar with the ketogenic diet, what that is that you are reducing your carbohydrates. And when you reduce your carbohydrates, at the same time, you increase your healthy fat. And what this does is it transitions your body from running on sugar glucose to running on ketones, which are made from fat. And here comes that word ketones again, and BHB. And that is the basic overview of what a ketogenic diet is. So why is that important with ketosis and PKD? Ketosis is the state of having ketones. I don't want to confuse you guys with the terminology, but when you are on a ketogenic diet, you go into ketosis. So here's why. Your PKD cyst cells, and this is only the cyst cells, the ones with the mutation, no other cells in your kidney. They're not flexible. Those are stubborn little cysts. They depend on glucose. When I say glucose, it's blood sugar. They depend on glucose for energy. They absolutely cannot use fat for energy. I like to say cyst cells have a sweet tooth. So they really like glucose. So when someone is following a ketogenic diet, preferably a plant-focused one, they have ketones, and that is your energy. So fat equals your energy when you are on a ketogenic diet, and those little energy nuggets are called ketones. Those ketones, your cyst will take them up to try to use them for energy, but guess what? They can't. They're actually toxic to your cyst cells. Not only that, but they have been shown to stop the laying down. Being in ketosis and having those ketones has been shown to stop laying down that scar tissue. So this is why the discovery of how cyst cells use energy and what they use, that sugar, is so big, because you can change that. And being in ketosis is actually a natural state. It takes a little bit of planning, but it's a very natural state for your body. In fact, most of us go into a slight ketosis overnight if we've had a good night's sleep for an extended period of time. So here's what we know about those ketones. And the main one that you're going to hear about is called BHB. So that's short for beta hydroxybutyrate. Now you know why I say BHB. So looking at the big picture of ketones, there's 3 ways to really produce or get ketones in your body. Intermittent fasting, and that means basically having a certain time of the day, a certain amount of hours that you are eating. And then also ketogenic diet when you are running on those ketones. And then also an oral supplement, a supplement of ketones. And all of these have been shown to have BHB, that ketone in your body. And that's what they have in common. And then of course you can see all of the research associated benefits of having that BHB in your body. Decreased cyst size, decreased kidney size, decreased scarring and fibrosis, all leading to slower progression and improved kidney function. So hopefully that gave you a little bit of an overview of what's going on. I know that there's a lot of talk about keto in the PKD world, and it's good. All right, just checking my time. So just to summarize, these are your opportunities, the new frontiers. And again, you do not have to do all of them. One small thing will have an impact. Every single one of them will have an impact. So it doesn't have to be all or nothing. And I really want to reiterate that because every single one is not for everybody. So your opportunities, you've got ketogenic therapy and also BHB production. You've got plant focused. You've got microcrystal management, those 3 focus ones. And then you've also got opportunities dealing with your urine pH and the particles. These are all new frontiers to help be proactive, be preventative, slow the growth, and overall, just very, very healthy changes within life. So I'm back to this picture, and I want to ask you, looking at this, so we've got your GFR and the cysts are increasing. I'm going to ask you to not hold off until you see that GFR decline. If you see that GFR decline. So this is where the decline is. But look, this right here is when we want to make changes. This is the period to be proactive and preventative. This is the period to slow that cyst growth, to fight inflammation, to make the changes. So we can push this drop back over here. So this right here. And it doesn't mean if you're over here with your function that you can't do this. It absolutely benefits. All of these do. But during this period, your kidneys are actually, what's working in your kidneys is working pretty hard. And this is basically when they say, okay, I'm a little worn out. And then you see the results. So right here is where the sweet spot, where you want to start working on some of those proactive nutrition changes. Okay, so just some take-home key points. 100% diet can impact your PKD progression. Nutrition for PKD is not 100% the same as CKD. You do not want to wait until there is something going on with your kidney function or it shows up, because there's always something going on. So it's not the same as CKD. You can be proactive in different ways. Also, there are opportunities to be proactive, and it's never too early to start, and it's never too late also. And there's just a little bit of my contact information there. So what can you do? And this is very baseline starting, because there's so much you can do. But if you are new to this journey today, what you can do is, number 1, blood pressure management. You're going to hear that, but ask your doctor what your goals are. Ask your doctor what your medications are that will benefit. Decrease your sodium intake. You can also avoid excess protein, and then increase your fluid intake. So those are very basic foundation, but there is so much more we went over today that you have the option to do. So if anything that you saw today, or I said today, you said, yes, I want to be proactive, or you said, I can do that, or you said, this is something that I want to try. Any of those opportunities, I invite you to join PKD Nutrition Academy to learn more about it. So PKD Nutrition Academy, I'm inviting you to join, but this has really evolved because working within the PKD community as a dietitian, I get asked all the time, where can I find good information? Where can I find how to do something? Where can I find trusted information? I want to do this. So because of that, and because of all the questions and the interest, this has led me to form PKD Nutrition Academy. So I'm excited to share it with you. So it's for you if you want to learn the why about PKD and nutrition, not just the why, but the how, but also to understand how to reduce your kidney stressors and how to practice proactive nutrition. If any of these is something that you want to try or learn more about, PKD Nutrition Academy is for you. So if you want to go from confused, Googling, not knowing where to start, how to start, to feeling confident about the information, confident about what works for you, this is where you want to come. That's exactly who I want to benefit with this. So what you'll get, and I put my little picture up here because it really is these nutrition opportunities that PKD Academy will share and educate. The only ones that PKD Nutrition Academy will not do is ketogenic therapy and intermittent fasting. There will be some education on it, but it is not a guide to those. There's other places that have fantastic programs. I mean, I say that because I lead some of them, but that, and if you need more information, if you want more information on that, that is where to go to get them. Of course, I'm speaking of the RenNu program and a lot of dietitians that practice plant-focused ketogenic therapy. But all these other opportunities, this is what PKD Nutrition Academy will bring to you. So it's an 8-week course. There's weekly videos. They're pre-recorded, so you can watch them whenever you want in the comfort of your own home. Watch them in your jammies. And so each week there's a different topic related to PKD and nutrition. So you learn the what, the how, and the why. It comes with step-by-step guides, handouts, recipes, and more. I love creating goodies, so I might have overdone a little bit. And then one of the benefits of when I go live with this, which is coming in the fall, is I'm going to be hosting a weekly Q&A call for everybody who's part of the Academy. So connect with your peers, come ask me questions. Great resource. And if you're struggling with something, we can pivot. Just really good to have that option. And also, you have lifetime access to PKD Nutrition Academy. So if there's anything updated, new, you have access to it forever and always. So I know you're asking, oh, forgot about bonus. How could I forget about bonuses? Bonuses time. So 2 things that come with being one of the early participants in PKD Nutrition Academy is, first is how to navigate your doctor visits, how to get the most out of them, what to ask specific for you. So I'd like to guide you through that. And then also understanding your labs, really understanding what to look at, looking at your trends. And so those will be 2 bonus modules coming with this. So I know you're asking, how do I get started? It's super easy. All you have to do is sign up for the waitlist. So if you joined me today via signing up and giving me your email and your name, surprise, you are already on the waitlist if you want to be. Now, if you join me today via Facebook and did not sign up through my waitlist, then I will absolutely provide it to you. Now, here's the great thing. You're just going to be getting more information. There is 0 commitment to being on the waitlist. You'll get important updates. you'll be enrolled to, if you do enroll, you get those added bonuses. And then also you get my special offers, which are definitely discounts. And then you get to connect with all things PKD and nutrition. That's me. I know we ran over a little bit today, so I'm going to stop there and thank you guys for coming. I see there are some questions, and so you are on mute. I am going to